Hello everyone, I'm Dr. Jill from India, and today we have with us a dynamic and passionate yoga teacher, Mrs. Marvi Khatwani. After doing her post graduation in mass media and communication, fell in love with yoga and got trained in various fronts of this holistic science, along with the training in prenatal, postnatal, pregnancy yoga at Aram Yoga Institute in Mumbai. Marvi is joining us right from New Jersey. Welcome, Marvi.
Hi, Mamta. Thank you for having me here.
So, Marvi, would you like to share with us what inspired you to become a yoga teacher?
Yeah, so it's just that good health has always been very important to me. And I worked in the corporate sector and began to understand the value of health even more. And that's when I got into yoga, and I'm like, this is what I've always wanted to do. And it was the right decision. And I am so happy today.
That's amazing. Marvi, how yoga actually heals us, or what are yoga's beliefs? Would you like to share something with us?
In general, as we all know, that exercise movement is good for the body, right? And so yoga for that component has asanas. For our mental health and well-being, yoga has pranayam, yoga has mantra chanting. For everything in your body, for every need, whether it is spiritual, physical, emotional, intellectual, yoga is there. For your intellectual, there are these yoga scriptures that force you to think about life, right? So it looks at the overall well-being of an individual.
Thank you, Marvi. So, would you like to share any experiences like this? Like, have there been a big change in someone's life because they started practicing this with you?
Yes, definitely. So, like I told you, I'll give you an example of it's hypothyroidism, which is the hormonal health. I have actually seen cases where there has been a reverse of the thyroid issue, where there is this pill that you need to take first thing when you get up in the morning, right? When you are suffering from thyroid. And they say that once you get on the pill, it is a lifelong thing that you have to keep taking it. But there have been cases where it is actually reversed, and these women do not have to take the pill, right? And having said that, I feel that every medicine has its place. What that means is your ayurveda or like yoga therapy, allopathy, everything has its place, right? And definitely do not stop it without the permission of your doctor, and always work. So these were the cases where like the yoga teacher worked in conjugation like with a doctor to arrive at that this person's reports were coming in like it was normal, so this person did not need and the of course the key is keeping the yoga practice on, which really helped keep the symptoms away.
Currently, if we believe in integrated medicine, like we can have Ayurveda also along with allopathy, but the doctor you are following, you should keep them aware about, Acha, I am taking this also, I am doing this therapy also. So it doesn't become a mismatch. Because something's effect should not be reversed by something else. You're always free to practice any other science also, but the key is to keep your doctor also informed about it. And just like how Marvi said, there may be cases ki acha, hypothyroidism is reversed or any of the conditions, because every science works in its own way. So there can be a case of reversal, but that doesn't mean that you yourself abruptly stop the drug. Okay, keep your doctor informed ki I have started this. So you also need to check your lab reports, and then if your doctor says okay, you have recovered and you can stop it, then only stop it. Do not make decisions by yourself if you are not the physician or the Ayurveda person.
Yeah, and especially when we are treating patients who have underlying health factors or like diseases, I personally make it key that whenever I lay out a sequence or whatever, I insist that they get permission from their doctors in order to proceed. I had one client who was also taking Ayurvedic medicines, and they would go to the doctor and they're like, I don't think I will mention to my doctor that I'm taking Ayurvedic medicines. And I'm like, oh no, you have to share with your doctor, and then you both can take a call on.
So can yoga play a big role in women's health or menstruators' health also?
Definitely. I'll mention a few asanas that really go a long way in helping you elevate symptoms like stomach cramps or any other PMS symptoms there, right? You can do Baddhakonasana, which is like a butterfly pose. A Supta Baddhakonasana is also very effective to elevate cramps. There is a series called Iyengar Yoga Menstruation series. A quick Google search will get that to you with a number of asanas that you can perform comfortably at home. And so, what you could also do is a variation of Viparit Karani where you're lying on the floor with your legs on the chair. All of these asanas really help elevate the symptoms. And with regards to the overall mental well-being during this time, we also have mantra chanting, om chanting, and all of that.
Many menstruators suffer from something known as PMS, that is premenstrual syndrome, or many of us are in like perimenopause. So the common thing with both of them is people get mood swings. Someone is so happy and suddenly they are so sad. So it becomes very difficult to cope up with this. Can yoga or pranayam help us with that also?
Oh, absolutely, Mamta. And what you said is the key word there, pranayam. So if you notice, whenever we get angry, what happens to our breath? It becomes a little shallower, a little faster, the pace is. And when we are a little relaxed, we breathe a little deeper, naturally, like in our day-to-day lives. So base our emotions is with our emotions impact is on the breath. So it can also be reversed. If we control our breath, it'll impact our emotions. Yeah, so then that's where pranayam comes in. So pranayam is important to help with those mood swings. However, if we are performing pranayam on days leading up to the periods or our menstrual cycle, we can definitely do a number of pranayams. But it is important to note that during the first 1 to 3 days, we should avoid like Bhastrika or the pranayams that are helping the flapping of the stomach, basically. So, or Kapalbhati, more importantly. We limit Kapalbhati, limit Bhastrika a little. We can do Nari Shodhan Pranayam, which is also the alternate nostril breathing. Anulom Vilom. Okay. Absolutely, yeah. That's another name for Nari Shodhan. We'll do Anulom Vilom. There is full yogic breath leading up to the menstrual cycle, which is sectional breathing. So it is abdominal, thoracic, and clavicular breathing. So these simple breaths can be performed. Similarly, simple and basic asanas can also be performed. It is important to note that the stomach should not get pressured, absolutely. You can do yoga asanas like Baddhakonasana, Yoga Mudra, and Paschimottanasana also. And it is important to avoid Shatkriyas while you're menstruating.
Okay. Marvi, many of us have a lot of pain during periods. So at that time, can we do something to reduce it? Maybe pranayam, maybe yoga. Is there something which can give us relief in that time? I have heard like child's pose or some 2 or 3 asanas help with pain. I have heard. So is that correct, Marvi?
Oh, that is it. Absolutely correct, Mamta. So the child's pose, that is the happy baby pose, and that does help elevate pain. So what you can also simply do is when you're on the mat, take a bolster or a pillow, keeping it lower back, and lying down like that. You can also do Supta Vajrasana, and so similar to where you're lying down on your back, and those asanas will help you.
Okay, so these asanas can help us in pain also. They will elevate
Yes,
the pain.
yes, absolutely. Ananda Balasana and Balasana can also be performed without any variations leading up to your menstrual cycle. And during your menstrual cycle, to elevate pain, we can use variations like keeping a pillow and then keeping our head on it and doing that. Shatkriya should be avoided during menstrual cycle, but leading up to your menstrual cycle, especially as a beginner when you learn Shatkriya, to us it was recommended like we did Vaman Dhoti or Jalneti straight for 7 days. Then it is performed once a week, and then once a week for 3 months, and then once a month from there on. And of course on need basis as need arises. Don't do, especially in case of heavy bleeding, do not do asanas that are putting pressure on your abdomen or the pelvis. And I also do say that for the first, if you are a yoga practitioner, for the first or the second day, if it is genuinely you're in discomfort or you're in a lot of pain, avoid doing any asanas, like or
Okay.
avoid doing in yoga. Take rest, and in fact, that is also what Ayurveda recommends in terms of take rest for the first day, like less on activity and on that front. And of course, like I mentioned, the Baddhakonasana, Supta Baddhakonasana, also like maybe some practitioners can also do Malasana leading up to the periods and all of those asanas.
Okay, so it's more important that we do these before our periods start. So during the periods, asanas are not that much recommended for.
In case of extreme pain, where you don't feel like moving your body, where you don't feel like, it is all right to take rest.
Okay, so Marvi, actually the yogasanas which you are suggesting, so can anyone do them by seeing any videos or?
Now, when you see the video, there are so many tutorials online, and definitely you can follow along. But I always insist, especially if you're practicing for the first time, if you are a beginner, I definitely insist that do it under the guidance of a yoga teacher. Okay, that is primarily because the little nuances or the little details that could make a difference, you are not going to catch it when you're just practicing it by yourself without any knowledge, right? And it is better to err on the side of caution, right? So be with a yoga teacher, train properly, learn, and once you feel like you've got a hang of it, definitely you can practice it at home by yourself. In today's time, thanks to COVID, there are a lot of free lessons, a lot of free classes, and yeah, it is quite affordable, but they should definitely consult a yoga teacher.
See, it can make a lot of difference when you do a yoga pose. So the difference between right and wrong may be very, very small, but you may not know it because you are a beginner. Just now you are learning what is yoga. So initially, at least, we should try to take it from a yoga teacher. It may be online, it may be offline, but at least where the yoga teacher focuses on you also and sees that your posture is correct or not, your breathing, your posture. So everything is important. Any other points you would like to add, Marvi, like regarding period health and yoga? What is the connection and how can we use it in a good way?
Okay, see, Mamta. So one key point is that if you have never practiced yoga and you are in your periods now and you decide that I want to start practicing yoga today, right? That I would say that is not a good idea, right? Start practicing leading up to your periods. Be regular and consistent with your practice, and then you will begin to see results. Like whatever challenges you are facing with your menstrual, also will help regular your menstrual cycle and your overall physical, it'll impact your overall physical well-being, right? And some, of course, when you're practicing, some key points have to be followed, like particular Shatkriyas, for that matter, pranayam, are best done on empty stomach. And especially for beginners also, it is very important that you listen to your body, right? Someone will say something, someone will say something else. There's just so much misinformation out there and so much information out there, right? You start your journey and then keep listening to your body, listen and follow through. And another key point that I do want to touch upon, Mamta, that many girls often ask, is it okay to do inverted postures during menstruation? Right, that's a very common question that comes up, and I want to say is that Ayurveda does not recommend, the perspective. It is also the flow of prana. It goes in the opposite direction from your menstrual flow if you're doing inverted postures. And like some might also say physiologically that the blood flow will go in the opposite direction into the fallopian tubes or all of that. But to counteract that, some may also say, Arey, but the heart continues to beat and push out the blood properly even when you're in the inverted postures. So what I say is the recommendation is that to avoid it for the first 1 2 days. And I'm someone, I do tend to follow the guidelines. It sits well with me. Like I listen to, I don't do inversion postures on the first duty. But again, from personal experience, the yoga has helped me immensely. It's only become better and better.
That's great, yeah. So even I have read in Ayurveda, they take that one of the reason of endometriosis is when you are doing inverted positions. So that's why Ayurveda does not recommend that. They think that the flow of prana or the flow of blood should not be inverted. It has to go down. At that time, you should not invert it.
Thanks to our modern day or urban lifestyles, we do have excess mucus buildup because of our bad, eating habits. So what this does is, and the new research has found that excess mucus buildup is linked to inflammation in the body, and inflammation is linked to a number of diseases. So imagine that thousands and thousands of years before, they knew that excess mucus buildup can actually be removed from your body. So these Shat Kriyas help in that.
Okay. So we'll be putting videos and small clips from the Aram Yoga Institute to guide all of you. So we will be giving the links of all the asanas that Marvi has told you in the description box, so don't forget to check that. So we hope that all of you will benefit a lot and your menstruation will become easier and your life will become healthier, and we'll come with many more videos with Marvi right from New Jersey again with us. Thank you so much for joining us.
Thank you so much,
Thank you,
Mamta.
Marvi. So everyone please share and subscribe, and we will be giving link to Marvi's channel as well. So thank you.